Stop. Before you take another multivitamin, you need to hear this.
3 vitamins. Recommended everywhere. And they could be quietly damaging your body after 60.
I'm going to say something controversial. The supplement aisle is designed for 30-year-olds, but marketed to 70-year-olds.
And your body at 70 processes vitamins completely differently than at 30.
Hey everyone, I'm Dr. Robert Harper, specializing in elderly care for over 30 years.
And I'm Dr. Akira Tanaka, family physician. Robert, let me ask you something.
Go ahead.
How many of your patients in the States walk in taking 5, 10, 15 different supplements?
Almost all of them. And here's the terrifying part. Most have no idea what's actually in those bottles, or why they're taking them.
My friend takes it. I saw it on TV. The bottle says heart health.
Right. And then I run their blood work and find out they're overdosing on things their body can't process anymore.
In Japan, we have a principle. Takasugi wa doku ni naru. Too much medicine becomes poison.
And that applies to vitamins. Just because something is sold over the counter doesn't mean it's safe for everyone.
Especially after 60, when your liver, kidneys, and absorption completely change.
So today, we're doing something direct. 3 vitamins you need to stop taking after 60.
Or at minimum, talk to your doctor before continuing.
And then 3 you absolutely must take if you want to protect your brain, bones, and energy.
Because the gap between what people think they should take and what they actually need, it's massive.
And it's costing people their health. So if you're over 60 and you've got a medicine cabinet full of supplements,
this episode could change everything.
Let's start with the first vitamin you need to reconsider. And Akira, I know you have strong feelings about this one.
Because in Japan, we figured this out decades ago.
Vitamin E, the so-called heart-healthy vitamin.
That might actually increase your risk of dying.
Wait, what?
You heard me correctly. For decades, vitamin E was promoted as essential for heart health, right?
Absolutely. I recommended it myself back in the 90s.
We all did. The theory made perfect sense. Antioxidant, protects cells, reduces inflammation.
And then the studies came out.
2005. Johns Hopkins analyzed 19 clinical trials. High-dose vitamin E increased all-cause mortality.
Meaning people taking it were more likely to die from any cause compared to those who didn't.
Exactly. And we're not talking about small doses. We're talking about 400 IU or more daily.
Which is what most supplement bottles contain.
Right. And here's the problem for seniors specifically. Vitamin E is a blood thinner.
So if you're already on aspirin, warfarin, or any anticoagulant, which many people over 60 are,
you're doubling up. And the risk of bleeding, hemorrhagic stroke, internal bleeding, it goes way up.
And most people don't think of vitamins as blood thinners. They think, it's just a vitamin. It's harmless.
But after 60, your liver metabolizes fat-soluble vitamins like E much more slowly. It accumulates.
So what should people do if they're currently taking vitamin E?
Talk to your doctor. If you're on blood thinners, stop it. If you're not, ask yourself why you're taking it. Get vitamin E from food instead. Almonds, sunflower seeds, spinach.
And from food, you're getting 15 to 20 milligrams, not the 200 or 400 you get from supplements.
Exactly. Food provides it in a balanced form, with other nutrients that help regulate absorption.
So bottom line on vitamin E, unless your doctor has a specific reason you need it, skip the supplements.
Especially if you're over 70 or on any medications that affect bleeding.
All right, what's the second vitamin we need to talk about?
This one surprises everyone. Calcium.
Wait, calcium? But we've been told for decades that calcium prevents osteoporosis.
And it does. From food. But calcium supplements, different story.
Okay, explain this, because I know a lot of my patients, especially women over 60, are taking 1,000 milligrams or more daily.
Here's the issue. When you take a calcium supplement, it floods your bloodstream all at once.
Unlike food, where calcium is released slowly during digestion.
Right. And that sudden spike in blood calcium? Your body doesn't know what to do with it. Some goes to bones, sure, but a lot of it
Goes to your arteries.
Exactly. Arterial calcification. Your blood vessels literally become less flexible, more brittle.
And this is backed by research?
2016, Journal of American Heart Association. Calcium supplements increased heart attack risk by 22% in older adults.
But calcium from food, no increased risk?
None. Because food calcium comes with magnesium, vitamin K2, other cofactors that direct it to bones, not arteries.
First, get a bone density scan. You might not even need supplementation.
First, get a bone density scan. You might not even need supplementation.
And if they do?
Take it with vitamin K2 and D3. Never more than 500 milligrams at once. And prioritize food sources first. Dairy, leafy greens, sardines.
In Japan, you don't consume as much dairy as we do in the States. How do you get calcium?
Sesame seeds, tofu, seaweed, small fish eaten whole. And we have much lower rates of osteoporosis, despite lower calcium intake.
Because you're getting K2 from natto and other fermented foods.
Exactly. K2 is the traffic director. It tells calcium where to go. Without it, calcium becomes dangerous.
So the message here is, if you're taking calcium supplements without K2, you might be harming your heart while trying to help your bones.
That's exactly right. And most American calcium supplements don't include K2.
So check your labels. And honestly, prioritize food.
Always. Food is medicine. Supplements are at best a backup.
All right, third vitamin to avoid. And this one I think is going to shock people even more.
High-dose vitamin B6.
Wait, B vitamins? But they're water-soluble. I thought you just pee out the excess.
For most B vitamins, yes. But B6 is the dangerous exception.
Explain.
At high doses, over 100 milligrams daily, B6 causes peripheral neuropathy, nerve damage, tingling, numbness, pain in hands and feet.
And this damage can be permanent?
Yes. Once nerves are damaged, they don't always regenerate.
So why are people taking such high doses?
B-complex supplements. People take them for energy, for stress, and they don't realize one capsule can contain 50, 100, even 200 milligrams of B6.
What's the safe daily amount?
For seniors, 1.5 to 1.7 milligrams. Anything over 10 milligrams long-term is risky.
So a 100 milligram supplement is 60 times the safe amount.
Exactly. And people think more is better. It's a vitamin. How could it hurt?
But it does hurt. What are the early warning signs?
Tingling in fingertips or toes. Numbness. Loss of coordination. Balance problems.
And if someone notices these symptoms?
Stop the B6 immediately and see your doctor. The sooner you stop, the better chance of nerve recovery.
Can you get enough B6 from food?
Absolutely. Chicken, fish, potatoes, bananas. You'll get 2 to 3 milligrams daily, which is perfect.
So unless you have a diagnosed deficiency and your doctor prescribes it, skip B6 supplements.
Correct. And check your multivitamin. If it has more than 10 milligrams of B6, it's too much.
All right, let's recap the 3 to avoid. Vitamin E, especially if you're on blood thinners.
Calcium supplements without K2 and D3. Prioritize food sources.
And high-dose vitamin B6. Stay under 10 milligrams if supplementing at all.
Now let's talk about the 3 you absolutely should be taking after 60.
Because this part is just as important. These aren't optional. These are essential.
And most people over 60 are deficient in at least 2 of these 3.
First one, and this is the most critical. Vitamin D3.
The sunshine vitamin. Except most seniors don't get enough sun to make it.
And after 60, your skin produces 75% less vitamin D from sunlight compared to when you were younger.
So even if you're outside daily, you're probably deficient.
What happens with vitamin D deficiency?
Weak bones, muscle weakness, increased fall risk. But newer research shows it's much more than that.
Cognitive decline, depression, heart disease, immune dysfunction.
Vitamin D receptors are in almost every cell in your body. It's not just a bone vitamin, it's a hormone.
So how much should seniors take?
2,000 to 4,000 IU daily. But get tested first. You want blood levels between 40 and 60 nanograms per milliliter.
And it has to be D3, not D2?
Correct. D3 is the active form your body uses. D2 is synthetic, less effective. Always check labels.
When should you take it?
With a meal containing fat. It's fat soluble. Morning or afternoon is fine, but not evening. It can interfere with sleep for some people.
I started taking 3,000 IU daily last year. Energy improved within weeks.
That's common. Most seniors are deficient and don't realize it.
One simple test, one supplement, massive impact.
And unlike the 3 we discussed earlier, D3 is very safe at these doses. Toxicity doesn't occur until you're taking 10,000 IU or more daily for months.
What's the second essential vitamin?
Vitamin B12. This one is critical after 60.
Because stomach acid production decreases with age.
Exactly. B12 needs stomach acid to be absorbed, so even if you eat B12-rich foods, you can't absorb it properly after 60.
What are the symptoms of B12 deficiency?
Fatigue, brain fog, memory problems, tingling in hands and feet, balance issues.
And many of my patients think it's just aging.
Yes, but it's often B12 deficiency. And if left untreated, it causes permanent nerve damage and cognitive decline.
I've seen people diagnosed with early dementia whose symptoms completely reversed after correcting B12.
Reversible dementia from a vitamin deficiency. That's why I test every patient over 60.
What form of B12 is best?
Methylcobalamin. It's the active form, better absorbed. Sublingual works well too. It dissolves under your tongue, bypasses the stomach acid issue.
How much daily?
500 to 1,000 micrograms. You can't really overdose. It's water-soluble. You excrete excess.
In Japan, you eat a lot of fish and seaweed, natural B12 sources. But absorption is still the issue after 60?
Correct. Even with great diet, supplementation is smart. This is one I take myself, daily.
Same here. 1,500 micrograms every morning.
And you feel the difference?
Absolutely. Mental clarity, energy, mood, it's noticeable.
That's the power of correcting deficiency. Your body was starving for it, and you didn't know.
What's the third essential vitamin?
Magnesium. And this one surprises people, because over 50% of seniors are deficient.
Why is deficiency so common?
Modern diet, depleted soil, medications, diuretics, proton pump inhibitors, both common in seniors. Both deplete magnesium.
What does magnesium do?
Over 300 enzymatic reactions. Muscle function, heart rhythm, blood pressure, sleep, mood, bone health. It's essential.
Symptoms of deficiency?
Muscle cramps, especially nighttime leg cramps. Insomnia, anxiety, irregular heartbeat, constipation, high blood pressure.
I see these complaints constantly in my practice. And people never connect it to magnesium.
Because doctors don't routinely test for it. Blood tests miss deficiency. Most magnesium is inside cells, not blood.
So how do you know if you need it?
If you have those symptoms, cramps, sleep issues, anxiety, try supplementing. You'll know within a week if it helps.
What form is best?
Magnesium glycinate. Best absorbed, doesn't cause diarrhea like magnesium oxide. Take 300 to 400 milligrams before bed.
Before bed?
It's calming, improves sleep quality. Many of my insomnia patients see dramatic improvement.
And it's safe for seniors?
Very safe. Only caution, if you have kidney disease, talk to your doctor first. Otherwise, Magnesium is one of the safest supplements.
Let's recap the 3 you must take. Vitamin D3, 2,000 to 4,000 IU daily with food.
Vitamin B12, 500 to 1,000 micrograms. Methylcobalamin, sublingual form is best.
And magnesium glycinate, 300 to 400 milligrams before bed.
These 3 address the most common deficiencies in people over 60. Brain, bones, energy, sleep, mood.
And they're safe, effective, and backed by solid research.
Unlike the 3 we told you to avoid, which have real risks after 60.
Now I want to talk about something important. The mistake people make with all of this.
Self-diagnosis and self-treatment.
Right. Someone hears calcium is good for bones, so they buy a high-dose supplement without checking if they even need it.
Or they take B6 for energy without realizing they're taking a toxic dose.
So what's the smart approach?
Start with testing. Blood work, vitamin D levels, B12, magnesium if possible.
Know what you're deficient in before you supplement.
Exactly. And bring all your current supplements to your doctor or pharmacist. Have them check for interactions, duplications, excessive doses.
Because you might be taking the same vitamin in 3 different bottles without realizing it.
Multivitamin plus B-complex plus separate B12. That's triple dosing.
And more is not better. After 60, your body processes and eliminates nutrients differently.
What helped you at 40 can harm you at 70.
So the 3 rules we want you to remember. 1. Get tested before supplementing.
2. Prioritize food over supplements whenever possible.
3. Work with your doctor. Don't self-prescribe handfuls of vitamins.
Your body is wise. It doesn't need megadoses. It needs the right nutrients in the right amounts.
Let's talk about the role of food versus supplements. Because I think this is where people get confused.
In Japan, we have a saying, medicine and food share the same source.
I love that. Because food provides nutrients in a package your body recognizes.
With cofactors, fiber, other vitamins and minerals that work synergistically.
Supplements are isolated compounds. They lack that complexity.
Which is why calcium from dairy or leafy greens is safer than calcium carbonate from a pill.
Or vitamin E from almonds versus synthetic tocopherol.
Your body knows how to handle food. It's been doing it for millions of years.
But supplements? That's a modern experiment. And we're still learning which ones help and which ones harm.
So the strategy is food first. Then for the 3 essentials after 60, D3, B12, magnesium, supplement strategically.
Because those are the ones most seniors genuinely need and can't get enough of from food alone.
Correct. Everything else? Question whether you need it.
Now let's address something controversial. Multivitamins.
Oh boy. Here we go.
Do seniors need a daily multivitamin?
Most don't. And here's why. Multivitamins are designed for average deficiency, not your specific needs.
So you might be getting too much of what you don't need and not enough of what you do need.
Exactly. And many senior multivitamins contain the 3 we told you to avoid. High-dose vitamin E, calcium without K2, excessive B6.
So you're paying for a product that might be harming you.
Better approach? Target your actual deficiencies with specific supplements.
Instead of a shotgun approach, use a sniper rifle.
I like that. Precision supplementation.
Now, are there exceptions? People who genuinely need multivitamins?
Yes. Severe malabsorption disorders, post-surgery, very restricted diets. But those are specific medical situations, not the general senior population.
All right, let's bring this home. We've covered a lot today.
3 to avoid, 3 to take. And why the standard approach doesn't work after 60.
So here's what I want everyone watching to do tonight.
Go to your medicine cabinet and gather every single supplement you're taking.
Line them up on your kitchen counter. Actually look at the labels.
Check for the 3 we said to avoid. Vitamin E over 100 IU, calcium without K2, B6 over 10 milligrams.
And make a list of everything you're taking. Bring it to your doctor at your next appointment.
Ask them, Do I need this? Is this dose safe for my age and medications?
And request blood tests for vitamin D and B12 if you haven't had them in the past year.
Those 2 tests alone can change your life.
Quick recap. 3 vitamins to avoid or be very careful with.
Vitamin E. Blood thinner risk, especially with medications. Get it from food instead.
Calcium supplements. Arterial calcification risk. Need K2 and D3 if taking it. Prioritize food sources.
High-dose vitamin B6.
Nerve damage at doses over 10 milligrams long-term. Check your B complex and multivitamin.
3 vitamins you should be taking after 60.
Vitamin D3. 2,000 to 4,000 IU daily. Get tested first. Take with food containing fat.
Vitamin B12. 500 to 1,000 micrograms. Methylcobalamin form. Sublingual is best. Prevents brain fog and nerve damage.
Magnesium glycinate. 300 to 400 milligrams before bed. Improves sleep. Reduces cramps. Supports heart and bone health.
Those 3 cover the most common and serious deficiencies in people over 60.
Safe, effective, backed by research.
And remember, supplements are meant to supplement a good diet, not replace it.
Food first. Always. Then strategic supplementation for genuine deficiencies.
We want to hear from you. Drop a comment below. Are you taking any of these 6 vitamins?
Will you make any changes after watching this?
And if this information helped you, please share it with someone over 60 who's taking multiple supplements.
This conversation could prevent serious health problems.
Next episode, we're tackling sleep. Something Akira has been after me about for months.
Because you think 5 hours is enough.
I function fine on 5 hours. Until then, take care of yourselves.
And each other.